Okay, so I understand that you've been dealing with some lateral knee pain that's been going on for roughly 10 to 12 months. You're a pretty avid runner, running about 15 to 20 miles a week, and then slowly started to go down to roughly about 7 to 12. And I understand as far as running being a pretty good coping mechanism, as well as just a good physical activity. Within that 10 to 12 months, I understand that you've been seeing multiple providers, and they've probably also given you some multiple diagnoses as far as what could potentially be going on. So I understand that is quite the cognitive burden on you, as is just you getting all that information from healthcare providers, as well as some of the life stressors as well. So before even giving a diagnosis, I just kind of want to explain exactly what this pain experience is. So essentially what pain is we get a noxious or a nociceptive stimulus that can be harmful to the tissue at first. That response is then set up to the spinal cord and what's called the dorsal horn of your spinal cord. That information is then sent up to your brain, and then your brain can handle it accordingly. Typically, what can happen with a pain response is, as far as tissue damage and the pain response, sometimes they acutely, so within the first 10 to 14 days, they can go hand in hand. And then typically when tissue heals, that pain response will typically go down. However, if we have a nociceptive input or that painful stimulus that is a prolonged, now good news is that can be reversible, but if it's a prolonged experience that makes your nervous system a little bit hyper alert or a little bit more vigilant or more better adapt to experiencing pain, this is a phenomenon called central sensitization, which I think is something that we've got going on right now. Now, there's a couple things in regards to the evaluation that we saw that we can address, what I like to call some low-hanging fruit. So there's definitely some things, low-hanging fruit, that we can address right now. There was some strength differences on one side versus the other. There were some muscle limitations, as well as a little bit of some joint restriction on that involved side versus your uninvolved side. My goal for physical therapy, as far as what I can do for you, is to address some of those low-hanging fruit from a physical standpoint to just make you feel good. I think running is going to be fantastic. One thing I would also suggest, if you're running by yourself, possibly looking into a running group. Nobody, as far as running goes, getting into a running group and then running with a group of friends that you guys can just talk and just kind of enjoy running, being outdoors, and then just getting to talk and enjoy fellowship with others is also another good option as well. You had mentioned a couple stressors that you've experienced with work as well as personal life. And I would also recommend and also challenge yourself to maybe we address some of those things as well. So there's something, whenever we are healthcare providers, something that we like to look at is what's called a biopsychosocial approach. So a lot of what we do is not just the biology of the tissue. A lot of it is, how do you interact? How are you physically? How are you emotionally? How are you spiritually? All of these things can attribute to this pain experience that we're having. So rest assured, I will give you my absolute best to address that entire model.